Hello, my name is Dr. Julian De Silva. I'm a London-based facial, cosmetic and plastic surgeon. Today I'd like to talk to you about how a facelift is completed and what are the essential components that are going to rejuvenate your appearance and give you a great looking natural result. Well, a good place to start is, well, what are the changes that we're actually seeing in terms of facial aging? Well, in essence, part of the changes result from gravity, part of them result from volume loss, and part of them result from laxity in the skin. And so what that results in is a change in your natural facial appearance with aging. And the face shape tends to change from a youthful V-shaped jawline to a more square-shaped jawline. We can really see this in this before and after animation. And that square shape of the jawline, well, that's a result of gravity. It's a result of the volume, the cheeks dropping downwards and resulting in jowls along the jawline. It's a result of skin laxity and a result of volume loss. Really, it's these three components which occur in different amounts for every individual person that result in the more tired, aged appearance. I personally ask patients to bring like an old photograph from even 20 years before, because we can use that as a blueprint for the surgery. Because some patients will have lost more volume, some patients may find they have just more loose skin, some patients may find they have more in the way of jowls, and so it's catering and customizing the individual surgery for that individual patient. My patients, well, I have a customized deep plane facelift, which I personally believe gives a more natural result because it's lifting the deeper soft tissues that have descended with gravity. That's a more advanced type of facelift. The common types of facelift are a lateral lift in the SMAS, but a deep plane facelift tends to give a more natural result. In addition to that, well, we want to have the fastest possible healing and the least recovery time, and that is often means less is more. The less surgery is done, the faster you tend to heal. Well, if we start to look at facial anatomy, beneath the skin, we have like a number of layers of fat. This subcutaneous layers of fat are divided into different compartments. And this has been a very powerful way of rejuvenating patients because over the last 5 years, fillers have become incredibly popular because they're non-surgical. They can add volume to these specific anatomical fat compartments, which can really rejuvenate the appearance. At the same time, too much volume is never a good thing because too much volume starts to look unnatural. Now with surgery and facelift surgery, while you can do procedure combined with fat transfer, which means taking some of your own natural fat, usually from around your belly button, and that can be put into certain areas of the face that will rejuvenate the facial appearance. And 50 to 60% of that fat will survive long term, and so it can be a very effective way of rejuvenating the face without using temporary measures such as fillers. Now beneath the fat, there are muscles that give you facial movement, and there are also important ligaments. And these are very important with facelift surgery because in order to lift and restore and rejuvenate the face, these ligaments have to be released to enable lifting of the face. And so key is a good understanding of the underlying facial anatomy. There are also important nerves, and nerves in the face really are of two different types. There's sensory nerves that give you sensation, and in almost every facial surgery, where there's been surgery, there is a degree of numbness. If you do surgery on the nose, the tip of the nose can be numb initially. If you do surgery on the eyelid is often a little numb immediately after surgery. Now with face and neck lift surgery, that really is surgery going in this area, well, this area is always numb for a period of weeks to months after the surgery, and then the sensation returns, and that's completely normal. The other type of nerves in the face are the motor nerves, and the motor nerves are what give you movement, and it's a completely different wiring system to the sensory nerves. Now the motor nerves, well, we really want to avoid these nerves with facial surgery because any stretching or tweaking of like a motor nerve can give you a temporary weakness. And the movement always comes back, but it can take a period of weeks and sometimes a few months for it to fully return, and that can be really frustrating. but that's relatively rare with facelift surgery. Beneath that, we have important blood vessels, and this is very important, particularly with more non-surgical treatments, but we need to be careful with the very dense anastomosis of the blood vessels, particularly around the eyes and the nose. And then beneath that, we have the salivary glands, and the salivary glands, well, they perform an important part in terms of eating and providing saliva, but sometimes in the neck, particularly, the salivary glands can either be have dropped with gravity, or they can just have a fuller appearance. And that's something that often for patients who have very full necks, well, it's important to take the salivary glands into consideration, because for some patients that may need reshaping in order to give them the best result. And underlying that, we have the underlying bone and skull. And the relevance in facelift surgery, well, in some patients who might have like a smaller chin, a smaller bone, that can make a significant difference to the appearance of their neck, because everything can be concertinaed in the back of their neck. And so for those patients, often it can be worthwhile considering a procedure such as a chin implant in order to give the best possible result in this area, because having that little bit more stretching in the neck will give a better angle to the neck. In summary, well, we've looked at the different factors that can occur with facial aging. We've talked about how those changes can be improved. I hope this information has been useful for you. Thank you for watching.